Really quickly, you guys will see this in John's class. This is a hysterosalpingogram. Those of you who have not seen this yet, this is just a study that is done to perform, or that's done to evaluate patency of the uterine tubes or fallopian tubes. So how it's done is a tenaculum is inserted through the vagina with these lovely pinchers, and a catheter is inserted just at the point of the external os of the cervix. Dye is introduced through the cervix, and then it enters into the uterus. As we inject more dye into the uterus, it's going to have nowhere else to go but down, but we've plugged up the external os, so it can't go down. So it's going to have to be forced out through the uterine tubes. And remember that in a female, the vaginal opening actually is a conduit that can enter all the way into the pelvic cavity or the peritoneal cavity. So when we have injected this dye, we are actually injecting dye, waiting for it to spill out the distal portion of the fallopian tubes. Remember the infundibulum, that expanded or widened area at the end of the fallopian tubes? And remember, it doesn't directly surround the ovary, it just kind of hangs out around it. So it's a direct opening into the peritoneal cavity. So as I scroll through this study, you can see dye filling the tubes. You can see how convoluted they may or may not be. And then when the dye starts to spill outside of the fallopian tube, then you consider the test complete. Okay, and you might do, this is like an oblique, here's the other oblique. And you want to make sure that we have contrast in the peritoneal cavity. So that would be a complete test, and they would consider these tubes patent if it has spilled in both tubes. I'm not convinced it's spilled on the left side, though. It definitely has spilled on the right. It's kind of uncomfortable. It's quite an uncomfortable test for a female to have done. It causes extreme cramping in the uterus. It's a muscle, and it doesn't like to be screwed with. So when you introduce this dye in here, it really causes that muscle of the uterus, of the uterine wall, to contract, and it's quite uncomfortable. But it's done to check patency of the tubes. Once we have determined that the tubes are patent, then the patient can go home, and oftentimes, if a patient was having difficulty getting pregnant, this test rather, is kind of twofold. One, it's diagnostic, but in other cases, it can be therapeutic. So maybe there was some kind of twist or something, or maybe a little teeny blockage, and forcing this dye through oftentimes opens up that tube, making it easier for a woman to get pregnant. It kind of creates a nice little passageway for the egg to travel. And you will oftentimes find that a woman will have this done, she'll find that her tubes are patent, and within a month or two, she's pregnant. This exam is also done to evaluate for patients who have, there's a new type of tubal ligation to cut off the tubes for sterilization. So for women who choose not to have any more children, there's different names. The one brand name that I know of is called Essure. It's basically just a clamp that you clamp on the tube, and you then wait a couple months, and then you come in and you have a hystero to make sure that the tube is completely blocked. So you would do the same thing that you would do for a normal diagnostic hysterosalpingogram, except we want to see blockage. We want to see those tubes not emptying into the uterine or into the pelvic cavity.